Hi. My name is Dominique, and I work with an organization called GlobeMed. GlobeMed works to develop undergraduates into people who are deeply invested in the movement for global health equity. Over 7 years ago, we got our beginning. A group of students at Northwestern have been donating medical supplies to a community clinic in Ghana. And one of the students from Northwestern had the opportunity to travel to that clinic and see how everything was going. And when he got there, he saw every single medical supply that they had sent still in its box, untouched. And he talked to community leaders to figure out what had happened, what had gone wrong. And a community leader told him, actually, all of these supplies are supplies that we cannot use here in our clinic, but we continued accepting them because we have been taught that Africans should listen to their donors. The student went back to Northwestern, and all of the Northwestern students got together and talked and realized that they had been participating in a deeply problematic system that featured imbalanced power, right? So they had been contributing to a system that was marginalizing the community in Ghana. And so GlobeMed was born. The GlobeMed model was born. In GlobeMed, each chapter is in a long-term partnership with a community health organization in Africa, Asia, or Latin America. And they work to support the goals of that organization over the long term with the understanding that is important for the global health movement and every movement to amplify the voices of those most marginalized and those who are experiencing the issue, and also the understanding that people and communities are the experts of their own experiences and should be leading the way to the solutions to the problems that they face. 3 years ago, GlobeMed embarked on a new journey. The journey was based around one question: can we address global health inequities in other countries if we do so in a way that perpetuates inequities in our own? We ask ourselves questions like, can we ethically partner with an organization in Peru that is working on income generation if we do so in a way that contributes to the cycle of generational wealth and poverty in the United States? If we do so in a way where wealthy students are able to travel to that community in Peru and gain valuable work experience while low-income students are left at home? Can we ethically facilitate a conversation about malnutrition in Bangladesh if we do so in a way that ignores or silences the voices of students on our campus who have personal experience with hunger? Can we ethically stand in solidarity with Ugandan LGBT activists if we as an organization sign on to a healthcare policy that excludes transgender people and does not provide them with the health care that they need? So obviously the answer to all these questions is no. But the question that we then ask is, well, how can we do this work in a way that is just? As the diversity and inclusion coordinator of GlobeMed, it's really easy for me to fall into a trap, and that trap goes something like, well, the problem is that people from XYZ group aren't here, and so maybe they just don't care about global health, and if we can just reach them and help them understand why it's important, they'll come to us and the problem will be solved. Or maybe they just haven't heard of GlobeMed yet by some strange stroke of luck, and so if we just do a little bit of outreach or something, they'll come to us and the problem will be solved. But what I know is that almost always it goes much deeper than that. The problem is usually, the problem I can say with GlobeMed, it's something about us. It's the way we communicate our message. It's the structures that we have set up. It's the policies that we have in place. And now we understand that we can't, if GlobeMed was a house, say, we can't just bring people into our existing house. We have to say, how can we make sure that this house is welcoming and accessible and desirable to everybody who needs to be in it? And if it means that we need to tear down a piece of that house and rebuild it back so that it works for everybody, then that's what we need to do. And so we have made a commitment that one, to understand the connections between the systems of oppression that create inequities in the United States, and understand that they are the exact same systems that create the issues that we are working in solidarity with our partner organizations to address. And then second, we've made a commitment as an organization that everything we do, from planning an event to releasing a new curriculum to advising our students, we want to do it in a way that not only addresses global health inequities, but dismantles problematic systems here at home. So what does that look like? We don't know all the answers yet, but what it's looked like so far a little bit is things like making sure we have gender-neutral bathroom options at our events, or critically examining our financial aid system that allows students to travel to their partner organizations, or developing a new chapter structure that will make GlobeMed accessible to community college students. Making that type of commitment, again, that commitment, we are going to understand the connections between these systems of oppression, and we are going to try to make everything we do dismantle those systems in our own country, in our own communities, and on our own campuses while we are working in this global landscape. That's going to look different for every single person in this room and every single organization in this room. But I challenge you to ask yourselves, what could that look like for me? My name is Dominique, and my humanity is tied with yours.